I'm going to be doing this brief voiceover PowerPoint on pleural effusion. This information has come from the Cleveland Clinic, the NIH, cancer.net, and lung.org. Pleural effusion, sometimes referred to as water on the lungs, is the buildup of excess fluid between the layers of the pleura outside the lungs. The pleura are thin membranes that line the lungs and the inside of the chest cavity and act to lubricate and facilitate breathing. Normally, a small amount of fluid is present in the pleura. Patient findings. Some patients with pleural effusion have no symptoms, with the condition discovered on a chest X-ray that is performed for another reason. The patient may have unrelated symptoms due to the disease or condition that has caused the effusion. Symptoms of pleural effusion include chest pain, dry, non-productive cough, dyspnea or shortness of breath or difficulty labored breathing, orthopnea, the inability to breathe easily unless the person is sitting up straight or standing erect, and a fever. Diagnostic methods. The tests most commonly used to diagnose and evaluate pleural effusion include chest X-ray, CAT scan of the chest, and ultrasound of the chest. Pharmacologic treatments. Pharmacologic management of pleural effusion depends on the condition's etiology. For example, medical management includes nitrates and diuretics for congestive heart failure and pulmonary edema, antibiotics for pneumonic effusion and empyema, and anticoagulation meds for pulmonary embolism. Non-pharmacologic treatments. Thoracentesis. If the effusion is large, the doctor may take more fluid than they need for testing just to ease the symptoms. Tube thoracostomy or chest tube. The doctor makes a small cut in the chest wall and puts a plastic tube into the pleural space for several days. Pleural drain. If the pleural effusion keeps coming back, the doctor may put a long-term catheter through the skin into the pleural space. The patient can then drain the pleural effusion at home. The doctor will tell the patient how and when to do that. Oxygen therapy, positioning, avoiding exacerbating activities, conserving energy, and relaxation therapy.